Hi, Professor Rowan. My name is Valeria Ortiz. I'm going to be doing the head-to-toe assessment. Unfortunately, I don't have anyone to do it on. My mom has been out of town for about a month and, quarantine, so I can't really do it on a friend. So I'm going to try my best to explain the whole procedure. Thank you. All right, so before anything, I would knock the door for the patient, making sure I'm going into the right room. So I'd introduce myself. Hello, John Doe. My name's Valeria Ortiz. I'm going to be your nurse today as I'm washing my hands, closing the door, closing the curtain for privacy. And then I would ask them if it was okay if I could check their ID band. So then I would check I have the right patient, and then I would ask them for their name, date of birth. So once they give me that, I know they're oriented to self, and then I would ask them, where are you, and who the present is. So if they can answer those questions, I would automatically know that my patient is alert and oriented times 4. I would then ask if they have any allergies, and in this case, they have no allergies. And then I would also ask if they're in any pain right now, and since all these findings will be normal, my patient's not going to be in any pain. So then I would also let them know, hi, I'm here to do your full head-to-toe assessment. I'm just going to be checking you from head to toe. If you have any questions, just let me know in between. But I'm going to go ahead and start the assessment. And then from there, I would instruct my AP to get the vital signs, or if I don't have one, I would just get them myself. And then all the vital signs will be normal. So then I will have my patient sit in a semi-filer position, just because it's easier for me to kind of start from the head and then make my way down to the body in that position. And then I would also note their mood. My patient seems pleasant, they're happy. So I would also note that as well. So then I would start at the head, and I would first inspect. I would notice that I don't see any lumps or bumps. I would also lightly touch and go all the way to the back of the head. So I would know there's no bumps or lumps on the head, that the hair is evenly distributed, and it is also symmetrical. And then I'd also inspect the face. I'd check if there's any acne or scars. I would also say that their face is symmetrical and their facial hair is evenly distributed. And then I would then move on to the ears. I'll use my pen light. I have it right here. There it is. All right, I'm not gonna flash it right on the camera, but I'm going to check each ear for any drainage or obstruction. So, and then I would also ask them if they have any, if they wear any ear aids, or they have implants or something. I'd also ask that. Okay, and then I would have the patient close their eyes, and then I'm going to go on one side of their ear, and I'm going to ask them to repeat after me. I'm going to say 1, 2, 3, and then they'd repeat that, and then I'd go to the other ear and repeat UNE. And if they can hear that on both sides and they repeat it for me, then that's testing cranial nerve 8, which is working perfectly. I would then have them close their eyes again. And I unfortunately don't have one of the cotton balls, so I just got a little Q-tip. So I would dip it in like alcohol maybe, or a scent. And I would have the patient smell it. And if they smelled it correctly, that means cranial nerve 1 is also working just fine. So then I would move on to the nose. I would get my pen light, or if it's bright in the room, I could just do it with a naked eye. I'd look up, I'd check for any obstruction or any deviation. So right now my patient has no deviation and no obstruction. And inside the nose, it's dry. And the nose is dry, and the nose is intact as well. The skin is intact. So I'm going to go ahead and ask the patient to smile for me. Smile, and then raise your eyebrows. So raise them, smile, and puff your cheeks like that. So that would also test cranial nerve 7. So if they can do that, that would be that nerve is intact. And then I would now move on to the eyes. I would get my pen light, and I'd go from one eye, shine the light, to the other eye. I'd make sure the eyes are dilating and constricting in an appropriate time. I would also check the color of the eyes, like around the eyes, making sure that they're white, or if there's any drainage, or I'd also ask if the patient has any contacts as well. So contacts are glasses that they wear. So right now I would note my patient's eyes are Perla, so the pupils are equal round, reactive to light, and accommodating. So I'd also have them track. So I'd have them look at the pen light without moving their head, and if they could do that, that's also tracking is testing cranial nerves 3, 4, and 6. And then so I'm gonna have them cover one eye and then shine the light, and then cover the other one, shine the light. That's cranial nerve 3 is Perla. So, alrighty. Alright, so I'm gonna have them close their eyes again, and then I'm gonna grab one of my cotton pads, but I'd use this, and I would move it along their face, on their cheek, forehead, other cheek, and I would ask them if they felt that, and if they did, that means cranial nerve 5 is also intact. So then I'm going to move on to the mouth. I'm going to ask them if they could open their mouth, please, and I'm going to have them stick their tongue out, and I'm going to check for any lesions, making sure that the mouth is pink and moist, making sure there's no redness or swelling on the back of the throat. And then I'm going to note that the uvula is in the midline, the tongue is pink, and there's no obstruction inside the mouth or the throat. And then from there, I'm going to have them stick out their tongue and move it side to side. And then I'll check for a gag reflex, and I'll have them swallow as well. And then this would check cranial nerves 9, 10, and 12. So then I'm going to have my patient move their head side to side, making sure that range of motion is there, and there's no signs of JVD. Alrighty, so then now I'm going to check the carotid artery. I'm not going to do it at the same time because you can cut off oxygen going to the brain. So I'm going to check one side first, making sure I feel it and it's strong and palpable. And I'm going to do that on the other side, and then I'm going to make sure that they're equal. So I'm going to note that. And now I'm going to auscultate with the bell of my stethoscope. So I'm going to go like this and just check on one side and check the other side. Alrighty. And I'm gonna note there's no abnormal sounds. And now I'm gonna check all the lymph nodes, starting with the sorry for my pronunciation, periauricular, and then post-auricular. Then you have your occipital, which is a little lower. You have your deep, you have your superficial, the retropharyngeal, and then submandibular, and then the supraclavicular is over here. And then during that process, I would ask them if they feel any pain or tenderness, and I would also note if there's any swelling or kind of bulging that I feel. So then I'm going to have the patient stand up and ask them to walk for me. I'm going to have them to put their feet together and their arms right by their side and their arms closed. So if they can do that, that means that they're negative for the Romberg's test, which means their coordination is great. So then I'm going to do my neuro assessment. I'm going to have my patient touch the tips of their fingers as fast as they can, just like that. And I'm going to have them lay down and put their right heel and slide it over their left shin right down to the ankles, and have that do it on both legs. And that would be the neuro assessment. And I'm going to check the chest area. I'm going to have them lay back down in that semi-Fowler's. Actually, I'll probably have them in like full Fowler's position, just so it's visibly easier to see. I'm going to check for symmetry. I'm going to see if there's any redness or if there's tubing or a pore, anything like that. for tenderness, but in this case my patient has normal findings, so the skin is intact. I check for skin turgor, so there's no tenting. That means my patient's well hydrated. And then there's symmetry when during expiration while the patient breathes. And then I'd have them, I'd check their strength, so I'd have them put their arms right out, and I'd have them push and pull on their arms, and then and they would flex as well. So if they put their arms to the side and flex too, I would also feel for that. And then, so the strength would be 2, which is normal. So normal to the patient. And then now I'm going to check the reflexes. So I'm going to get the small hammer. And then I'm going to check the brachioradialis, the bicep, the tricep, reflexes. And then all those, again, will be normal findings. So then from there, I'm going to go to the capillary refill of the fingers. So I'm going to check each, on both sides, making sure that the capillary refill is less than 3 seconds. So from there, I'm going to also take the heart and the lung sounds. So I'm going to listen for the aortic. So it's your aortic, pulmonic, your herbs, tricuspid, and mitral. And then for the aortic, S2 will be louder than S1, and then as well as for pulmonic. And then you check herbs for 1 minute, and then from there, the tricuspid and the mitral, S1 is going to be louder than S2. And then I'm going to have them sit up, and then I'm going to check the apical pulse down there for 1 minute. So the normal would be 60 to 100. So, I would definitely check that. So I would also note that there's no heart murmurs or an S3 or an S4 present. All right, so from there, I'd have them stay sitting up so I can check the lung sounds. I'm going to check 6 in the front and 8 in the back. So I would go right, so right, left, down, turn, down here. And then from the back, I would do that same thing. So I would have them breathe in and then breathe out, and keep doing that as I keep moving the bell of my stethoscope on each position of their anterior and posterior lungs. So I would note that there's no adventation sounds in, and that the anterior and posterior lung sounds are bilaterally clear. All right, so from there, I'm going to have them lay down. I'm going to move down to the stomach area. I'm going to ask for the bowel, their last bowel movement. So I'd ask them for the color and consistency. I'd ask them about their urinating, if there's any pain, hesitancy, or color or odor. I'd then go ahead and inspect the abdomen. I'd make sure to check for any masses or bulges. And then from there, I'm going to auscultate. I'm then going to listen for 5 to 35 seconds for sounds. And then from there, I'm going to start from the right lower quadrant. So the right lower quadrant, make my way up to the right upper quadrant, then to the left upper quadrant, and then to the left lower quadrant. And then I would note that my patient has active bowel sounds, which are good. And now I'm going to percuss. So then each in that same order as well. And then I would palpate the patient's abdomen as well, and check if there's any pain or tenderness when I do either of those. So then I'm going to check the legs. So I would touch the calves. I would ask them if there's any pain in the calves when walking. I would check for any redness or edema, or I would also note the hair distribution in the lower legs. And then if the skin is warm to the touch. So I would also note all those things. I would ask the patient to lift one leg and then the other one to check the strength. And then I would have them push and pull toward against gravity. So I would put my hands there and ask them to pull, and then ask them to push as well. And then so I'm gonna have them bring their legs out and in, making sure they can extend them great. And then I'm going to ask them move their ankles in a circular motion, so I can see their range of motion as well. So I would have them do it on both right and left sides. So after asking the questions about pain in the calves or in the legs, I would then start checking all the pulses in the lower extremities. I would check first the pedal pulses, I would check the dorsal pulses, and then the popliteal pulses as well as checking for the capillary refill on the toes, making sure again they're less than 3 seconds. And then from there, I'm also going to check the patellar reflex with the hammer as well. And then from there, I'll be all done. And I would ask the patient if they have any questions, comments, or concerns. And if they need anything, there's the call light. And I would direct them how to use it as well, so that if they do need something, they know how to reach their nursing station or the personal nurse's phone. So then I would say thank you and have a great rest of your day. I'll come check back on you in about an hour or two. And then I would close the door again for privacy, and I will be all done. All right, thank you so much.